Hi guys, thanks for joining me. I am Dr. Ayele Okine and this is This Vet Wants You to Know. Today we're talking diabetes. Diabetes is probably one of the more frustrating diseases that I treat, but it is very common in both cats and dogs. A lot of people have familiarity with diabetes from their own health issues or family members, or they've had pets with diabetes in the past, but we definitely see it. Diabetes occurs when the body either doesn't make enough insulin or the body can't appropriately respond to insulin. Insulin is made in the pancreas, and insulin is the key that unlocks cells to allow glucose or sugar to actually enter the cells to be used for energy. There's two different types of diabetes. Most of what we see in pets is going to be type 1 diabetes, which is an insulin requirement diabetes, so they must receive insulin to bring down their blood sugar. Most people and some cats will be type 2 diabetic, where basically their body just either can't respond appropriately to insulin or they're just not making quite enough. And so with diet change or exercises or taking them off medications that antagonize the effects of insulin, or even giving oral hypoglycemic agents, we can actually bring the blood sugar down without needing insulin. But again, most pets are going to be type 1 diabetic, where they do require insulin. Dogs, for the most part, once they become diabetic, they're diabetic for life. I have had a couple of patients that if we can identify the diabetes and they're on a medication or have some other disease process that we think is antagonizing the effects of insulin, sometimes being able to identify it quickly, remove that antagonizing factor, sometimes they will go into remission, but most of the time dogs are going to be diabetic forever. Cats, on the other hand, can sometimes have their pancreas recover and they can go into remission, but that remission is not always a guaranteed fix for the rest of their life, so they have to be very careful. When we have a diabetic, again, most of the time we're identifying it either on blood work because they're coming in and we're just catching it, or they're sick from it. And what we typically will see when your blood sugar goes up is that actually draws a lot of water into it, and all of that sugar goes out into the urine. And so we tend to see that these guys will urinate a ton and then drink a ton to keep up with it. They often will lose weight because, again, insulin is that key that allows the cells to get fed. And so if you're not able to utilize that energy, your body, your cells are going to essentially be starving. We also will see that some of these guys will be managing for a while. No one really knows that they're diabetic, and then all of a sudden some other disease process hits them and then they get sick. And what happens with these patients is they develop what's known as ketosis. So you've probably heard of the keto diets. Those are really popular. Ketones in very small amounts are fine, but in large amounts with a diabetic, they can get really sick. Ketones are basically the body's energy source when it can't utilize sugar. So if you've been fasting and there's not any new sugar coming in, or in the case of a diabetic, when you don't have enough insulin to utilize that sugar, your body's going to need energy in a different form. What happens in that situation is your body will start to metabolize fats and proteins, and you'll start making ketones, which, again, in small amounts your body can use, your brain can use, everything's fine. But if you don't turn that process off, or if that process is going haywire, in the situation of a diabetic, where again they don't have any other option, those ketones are acids and they make the body feel really ill. You can vomit, have diarrhea, you don't want to eat, you get lethargic. And so we'll often see that a new diabetic will actually get diagnosed because they've gone in ketosis and they've gotten really sick and need to be hospitalized. The only way to turn off that ketosis is to give insulin, because essentially you need to give the body another energy source, and then give your body time to get rid of those ketones that are already floating around in circulation. So those are patients that, one, we need to figure out what caused them to get sick, what other disease process is going on. Oftentimes that's pancreatic inflammation. We tend to see that diabetics are predisposed to that. But it could really be anything. Foreign body in the gut, inflammation of the gut, another disease process like Cushing's disease. So there's all these different things that can make these guys sick. We have to not only identify what caused them to be sick, but correct that problem and manage them in the hospital for the ketosis, get them on insulin, an insulin drip. So they're basically getting insulin around the clock. We want to bring their blood sugar down to a more acceptable range and support them until they're starting to feel better and eat better, and then we can get them started on long-acting insulin that they'll actually go home with and the owners will administer at home. Typically with diabetics, when they're stable or once they're out of ketosis and eating well and can go home, most of the time insulin's going to be given twice a day. So that's going to be with breakfast and dinner. I always recommend feeding the pet first because we want to make sure that they eat so that that insulin has something to work on. And we also want to make sure that they don't vomit. So I usually recommend feeding, waiting about 10 or 15 minutes, and then giving the insulin. And again, roughly 12 hours apart. Again, we want to make sure that these guys are on a schedule, that the insulin, which typically is going to last 8 to 12 hours, depending on what type of insulin it is. We want to make sure that it's far enough apart from the last dose that we're not getting cumulative effects. We also want to make sure that these pets are on a food that they like so that we know that they're going to eat and that we can give the insulin. So I have a lot of clients that say, hey, are you going to change my pet's food? We may down the road if we're struggling, but typically if there's a food that the pet is on that they enjoy, I tend to keep them on that because I want them to eat. I want to know that my clients are going to be able to give them insulin twice a day, every day for the rest of their life. So I usually don't change their diet unless we're struggling to control the diabetes. There's different insulins that I'll start with, but the thing to keep in mind is there's more than one insulin. So if we start an insulin and it's not working for their pet, we're not getting their blood sugar controlled, there's always another insulin that we can try. The human insulins are going to have one type of syringe, and then the veterinary insulins are going to have a different type of syringe. So we always have to make sure that we're pairing those two together and not mixing things up. The insulin is a molecule, it's fragile, so we have to make sure that we handle it gently. We also want to make sure that we keep the insulin ideally in the fridge. It just helps it last a bit longer. And even though in people the insulin's only good for about a month, in veterinary medicine we do find that the insulin's good for about 3 months, so it lasts a lot longer than it does in people. The insulin's given underneath the skin, typically somewhere on the nape of the neck or between the shoulder blades, and we try to stick with the same area just to not add any sort of human error or any major changes. There are some pets that they can build up scar tissue, and so we might have to change it at some point, but typically we're going to give it right in that same area, again, twice a day. We want to make sure too that if for some reason the pet doesn't eat once, that we're just giving a half dose of insulin. If the pet doesn't eat 2 times in a row, they have to go to the vet. They have to figure out what's going on so that we can hopefully prevent ketosis from developing.